Hello everyone. I hope you can hear me well. I'm using a microphone today. Thank you very much for being here. I'll just wait for a few more minutes for people to come in. I had some more registrations today, believe it or not. So um, we'll see what happens. I know because of the um, time differences, some people actually watch this a little bit later. But let's see how many participants we'll get today. So I'm welcoming everybody today. I am Maria Rigopoulou, and you probably have found me on social media, Facebook group. I can see some names from yesterday, Deborah, I can see here, and I think Anne as well. Julia, welcome back. And with a few of you might have worked in the past as well, have been clients of mine. Here we're going to talk today about the 4 steps to stronger bones. And we started yesterday by looking at the missing pieces. So today is really talking more about the hidden issues in bone health. And I think the hidden issues in anything that has to do with any sort of degenerative condition. So let's see, anyone in the waiting room? Okay, so I will start then and we'll see how it goes. Right. Oh, how can I make my screen bigger? Here we go. So 4 steps to stronger bones. Please keep your microphones closed. If you can't hear me well, just let me know, because I had some issues with the sound yesterday. There was some issues, so please let me know. Let me know in the chat. You can use the chat anytime. It's going to take about an hour approximately, and we're going to have quite a lot of questions and at the end, questions and answers. But use the chat, whenever you like. So yesterday we started with the missing pieces. So what are and we talked a lot about what the current narrative is on bone health when we're focusing on calcium and bone density, but actually everybody is different, and it could be something different that is a primary driver of the bone loss. Today we're going to focus a little bit more on the hidden issues behind your osteoporosis or osteopenia. And tomorrow is going to be a little bit more practical. We're going to cover the roadmap based on my personal experience and my clinical experience over the last 20 years. Since yesterday there was a little bit of a problem with the recording, so this part was missed. I'm going to reintroduce myself for also people that don't know me. I was diagnosed with osteoporosis at 32. My bones were in a very bad state. My doctors were worried that it could be bone cancer, primary bone cancer, and I was very confused and very fearful and very scared, and I had panic attacks, and it was a horrible experience that I don't wish on anyone. And what this actually triggered is an interest in not only bone health but in health overall. So now I'm a nutritional therapist, a nutrigenomics and bone health specialist, working for over 15 years with people over 20 countries. So the hidden bone things, so why some people do everything right and still struggle. And that was part of my own personal story as well. The first few years, I thought I was doing everything right and I was following the advice, but actually I wasn't seeing any improvement, especially in my bone density. I was very much focused on bone density back then. Later on, I understood that bone strength is a lot more than density, but back then I wasn't even studying nutrition, so I was just trying to understand what was going on with my body, and it was really difficult and very stressful back then. So, what were your biggest insights from day one? Some of you've been here yesterday, so it would be interesting to know, if you want to put in the chat, what was something that maybe stood out for you yesterday. What stood out for me, not only from yesterday, but in general, and I think we had a conversation with someone from the group, I think it was Anne, that it can make a lot of difference if we focus on the wrong thing instead of what we need to focus. I think Anne mentioned, if I remember her name right, she mentioned that she had a problem with gluten, for example. And it is obvious that's where she needs to start, so not from calcium or protein or collagen supplements. So by starting by something else and distracting yourself on what the real issue is not going to get your bones any better. That was what stood out for me, and it was part of the Q&A at the end. But if you have anything else to add, please, you can tell now, or you can add later on during the chat. I keep having an eye on people that are in the waiting room and want to join. So if I look a little bit distracted, that's the reason why. Welcome for people that just joined now. We just started, as I said yesterday, we covered the missing pieces, and today we're talking about the hidden issues behind your osteoporosis or osteopenia. So yesterday the first time we talked about the 4 pillars of strong bones. I'm mentioning this again for people that haven't been here yesterday or haven't watched the recordings. The 4 pillars of strong bones is nutrition, movement, inflammation, and mindset and emotional health. And as I said yesterday, nutrition and movement is usually what we hear a lot about, but inflammation and mindset not so much. However, each one of these pillars could be applied differently to each person. So there's a lot of nuance that can happen at pillar level as well. However, I would say there's pretty good advice. There's a lot of advice out there on nutrition and movement. It still can be quite a bit of confusion, but there's a lot that you can find out there on nutrition and movement for sure. That's definitely certain. So how many of you have thought that I'm really doing everything I can, but my bones aren't improving? And that was my personal journey as well in the first few years. How many of you have thought that? If you have been in that journey for a while, I've been in that journey for over 20 years, but it might be something new. But if it has been happening, or you have discovered it for a while, is it something that actually gets into your mind? I'm doing everything right, but I cannot see my bones improving. And how you actually measure the improvement as well, that is also very important. I guess on a DEXA scan, which is not enough. We need a lot more information to actually assess what is happening with our bones. But this is a huge subject to start right here. Yeah, my DEXA and my REM scans showed no improvement and a slight decrease DEXA. Yes. Yeah, yes, Deborah is just saying in the chat that, I totally understand. I was exactly in the same place, and I'll explain, why this can be happening, and explain a little bit later. And yes, not taking calcium supplements. I guess calcium supplements is something that I don't regularly recommend as well. And we mentioned also yesterday, not probably a great choice. I ended up with a lot of calcifications when I did that in the past. So most people think that bone loss is a bone problem. And what if it's a whole body issue? And that's basically that's the reason why you're not improving. So to answer to Deborah, probably there is something else that has been happening, and probably for a much longer time than what you think before getting into perimenopause, menopause, that is actually driving your osteoporosis. And this is the reason why you see no improvement. This was the reason why I was seeing no improvement for a few years. And actually I saw improvement after menopause, which was like, I was very stressed about menopause when I became menopausal, because I was diagnosed with osteoporosis at 32. But actually I have even improved my bone health and bone density after I became menopausal. But back then I was like fully stressed, and for the first few years I wasn't seeing any improvement. Bone is a living tissue and is constantly rebuilding. You can see here again in the little nice picture here, breakdown, the old bone needs to be removed. Stopping bone loss is not a healthy thing. It needs to happen, but it needs to happen at a rate that it doesn't hurt bone formation. So we never stop building new bone. The rate of building bone is what is changes. It starts changing in our 30s, not when we get into menopause, and that's the same for men and women, but women are a little bit more vulnerable to it. And the main thing that we need to ensure during our whole life, and especially after 30s, and especially after menopause for women, is that bone formation is actually happen at a much faster rate than bone loss. So bone loss doesn't stop, it accelerates. Bone formation doesn't stop, but it slows down. So we have to make sure that bone formation does not slow down, as in a way that it doesn't, the older bone is not replaced by the new bone. So as long as bone formation is happening at a higher rate, or as at the same rate with bone loss, then we're fine. That's what we need to care about. So the question really here is, not the calcium, but what is actually helping bone formation, or what helps this balance happening. And I wanted to think a little bit about, as we're going into the section of the presentation that talks about the hidden issues. What happens when the body is constantly fighting fires? And we talked about the 4 pillars, and nutrition and movement. Yes, we know a lot of things about that, or we think we know a lot of things about that. But then the third one was inflammation. Inflammation, I mean, the word itself means, something is inflamed, is inflames. So what happens when somebody is constantly fighting fires? When the body is constantly fighting fires, it's going to direct all its resources to fight these fires. There's literally no resource that is, you can actually allocate somewhere else, and especially in your metabolism, bone metabolism, which naturally bone metabolism as a metabolic process is quite slow. To completely regenerate a whole skeleton, every single bone cell, it can take up to 10 years, even on a healthy, with someone with healthy bone metabolism. So hidden bone thief number 1, inflammation. And inflammation is a very generic word, and there's a lot again that you can find and what really inflammation is. I mean, inflammation, first of all, is a healthy response from the body when it's actually trying to fight something, an enemy, an infection, injury, whatever. Inflammation becomes problematic when it becomes chronic, when the body is always in that inflammatory state. And that happens when you have a metabolic inflammatory condition, and that could be diabetes or autoimmune disease or whatever. But actually, the everyday sources of inflammation that can be hidden or dismissed or ignored, but cause most of damage, and especially on your bones, are poor sleep, blood sugar swings, chronic stress, digestive issues, and a big one, poor detoxification ability, which usually, because I work with people, very personalized approach, one-to-one, looking at the genetics, people that have genes that are related to poor detoxification are the ones usually that have early onset osteoporosis or severe osteoporosis after menopause. So it's not random. It's because all these over a long period of time can cause inflammation, which is low grade inflammation, but it's accumulating, and it is a cause of all aging, of all degenerative conditions, and especially bones. Because remember, with the bones, you don't really have any symptoms, any bone symptoms. You might have other inflammatory symptoms, but not any bone symptoms unless you have a fracture. And actually, this is how I discovered my own osteoporosis. I had consecutive fractures that very easily, I was just falling down. I was having a fracture that nobody could explain. And my doctor sent me to have a DEXA scan, and I was diagnosed with osteoporosis. And then they thought my bones, they were so bad that I have bone cancer. So unless you get to a stage that you have a fracture, or you have a DEXA scan for whatever reason, because you enter menopause and your doctor says that you have to, you can't really have any symptoms. Very rarely, unless you have very advanced osteoporosis. Why this matters for bone health? Because when the body is focused on survival, when we are focused on survival, it becomes harder to prioritize repair. And think about the lifestyle as well. If it's something very stressful happening in our lives, all our focus goes there, and we don't have no time to go for holidays or go out with our friends, or do something that we like, because 24/7 we're just focused on these things. So the body is exactly doing the same thing. And if the lifestyle also is very stressful, eventually it's going to have an impact on the bone as well. And I'm using again myself as a case study, because I think I presented a lot of the symptoms that I've seen in many of my patients that don't have any obvious reasons. So that go beyond the menopause. So I was reacting to most foods, especially dairy. I had constant digestive pain and bloating. I was avoiding social events because I didn't know how my body would respond. I was that sick. I was getting sick over and over again. Like colds, flu, and things like that. I was getting fatigue and muscle ache. I used to have long periods of amenorrhea that of course contributed also to bone loss. And the more I was looking for answers, even after my diagnosis, the more confused I became. So I had all these symptoms that had nothing to do with bone health, but they had something to do with bone health. But nobody actually stayed with me, having the conversation, asking the questions, finding out what was happening, and actually addressing these issues, these concerns. And because this is what led to my bone loss, the bone loss of the osteoporosis. And that's what happens with most people. It doesn't start with menopause, it starts a lot earlier. It's just with menopause, it's just being revealed, it's just being exposed. So it wasn't until I looked beyond the obvious that things finally started to change. And that took me a few years to get there. So I would say a good 4 years to get to its stage to recognize that the other symptoms that I had were related to my bone health. And it was about the time when I started studying nutritional therapy. The not so obvious for me, it was lack of iodine. It was just making my metabolism very slow. And of course, my bone metabolism is very slow. Chronic stress, definitely. Random eating habits. I was working in an office and I didn't really have any main meals. So I was relying on snacks, and it was I was an electronic engineer. I was working in telecoms, and it was a very, heavy demanding, I was working for many hours, project related work. I wasn't eating main meals. Not enough protein and fat for my activity levels and for my stress levels. Very active person, very sporty, very busy life because of my job. I was managing a team of, I don't remember how many people, in a very, I would say, aggressive environment, very male oriented as well. There was a lot of male energy about doing everything fast and be very productive and etc. I was the only woman in the building that I was working, actually, so it was a tough environment to be with, and very stressful. So these were the not so obvious things that I had to go and address, and not taking calcium and doing exercise for bones. Actually, I had to reduce exercise because I was doing too much. So it wasn't obvious. And for the first 4 years that I was doing the obvious, I wasn't really seeing any things changing. Actually, my bone health markers were off the roof. I remember my doctors were saying that my bone health markers were like similar to someone that is 80 years old. That was not very helpful, by the way. So the pillar that nobody talks about, the second one, is mindset and emotional health. And I talked a little bit on this one, when I shared my story with you. That was the stress factor coming from job, but also for personal life. It was a big one for me. And this is something that is missed or dismissed in bone health and in any sort of degenerative conditions as well. And remember, talking about, I had a workshop, I think it was 2 years ago, with a colleague of mine who is a trauma specialist. And we were talking about the trauma of the diagnosis, and think about the fear of the diagnosis itself and what does this makes to you. It's about the fear, the anxiety, the hypervigilance, the confusion, the loss of confidence. All this can happen to anyone that is getting a diagnosis with osteoporosis and osteopenia, especially when they're young, but even after menopause, especially if women, they get into the 50s, they get into menopause, and they think that they've done everything right, and then they get a DEXA scan and everything just completely disappears. It just, the illusions just goes away. How fear changes behavior, and that's the indirect way that stress and mindset affects bone, by putting our bones in a catabolic, or our bodies in a catabolic state, which means that we use our own tissues, our own resources, and we lose calcium, and not only from the bones. We avoid movement when we're fearful. I remember I was very fearful for a long period of time. I stopped doing any exercise because I think I'm going to break into pieces, because that's what doctors told me. They told me that I have the bones of an 80-year-old. Avoiding exercise, second guessing decisions, not sure what you have to do, what you have to eat, if you have to exercise, if you have to go out, etc., etc. If I have to go for skiing or hiking, or some of the questions. I even heard questions about, and that was real question for middle people in my group. Can I wear tight jeans? Or, I'm going to have a fracture. Which is like, it's just crazy. But people get so scared, that even scared to wear their favorite clothes, because they think it's too tight and it's going to cause them a fracture. Which is crazy if you think about it. But there was a real question from a real person in a Facebook group. And constantly searching for answers. Stress affects recovery, inflammation, of course. It will also make inflammation even worse. Sleep, consistency, but also, as I mentioned yesterday, it has a direct impact on the bone. We know now that bones themselves, so our skeleton, has its own receptors for serotonin and neurotransmitters. And we know it's a neuroendocrine organ itself that responds to other hormones, not only creates hormones itself, but also responds to other hormones and neurotransmitters as well. So if you are depressed, if you are stressed, if your serotonin levels are low, or your dopamine is all over the place, this is going to have an effect directly on the bone, not only indirectly through behavior and changing habits around food and exercise. So one of the biggest lessons I've learned all these years, like 20 years now, 21 years now, the answer wasn't another supplement. It wasn't more exercise. Actually, in my case, it was less exercise, but just the right one for me. The answer was learning to listen to my body instead of following rigid rules. And that was the shift that transformed not only my health, not only my bone health, but my confidence, my mindset, and ultimately my whole life. I've changed my whole life. I've changed careers. I became like a different person, to the point that I feel that my Maria before 35 was a different Maria. Like, I see her like something in my life before that is like somebody else's life that I'm watching on the screen. That's how much transformative this was for me. So, I mean, which hidden bone thief surprised you the most? If it did surprise you, or if it didn't, is it something that you also see in yourselves and you don't know how to change? Inflammation. Yeah, inflammation. I know, Deborah. And it's outstanding. I think inflammation, probably the stress factor that people think about it, and there's a lot of awareness, I think, about trauma and the effects that this has on the whole of the body, not only bones. So there's a lot more awareness about stress and mindset and emotional health, but not so much about inflammation, because inflammation, emotional health, yeah, for you was emotional health. Yeah, a big one for me. Yeah, that was a big one. Yeah, inflammation goes undetected because it's a little bit I don't know. It's a broad term, and it's difficult to actually say what inflammation is. But inflammation, like I mentioned before, it can start with very little things over a long period of time and accumulate. So even if you don't sleep well for a long period of time, it's actually going to increase low-grade inflammation all over the body. And talking about test, and we covered that yesterday a little bit. To measure inflammation, to get to the point to actually measure inflammation in the test, in the normal test, you have to be really inflamed and really sick. There are some, more, I'd say, advanced tests that I'm also using with my clients, including genetic testing, that you look at inflammation from a deeper and different perspective. So not only the normal test, and you can actually predict and protect someone before they get into that inflamed state, but actually, yeah, inflammation is a vague one, and that's why it goes undetected. And it's a tough one. It's a tough one if you have to do it on your own. If it's a tough one if you try to figure out things yourself. It's really a difficult one. And then, yes, I mean, when I work with one-to-one with my clients, with my patients, yeah, it's fine. But we spend months, sometimes a year, working on that, and sometimes we spend a lot on testing as well. And most people are very overwhelmed. They can not be doing that for 6 months, and they don't have the money to invest to all these fancy tests that some of them exist, but yeah, difficult to access. So bone health is not only what you take. It's about how you live, how you move, how you recover, and how you think. For me, that was a big one. How I think, definitely. So the 4 pillars work together, and we have nutrition, movement, inflammation, and mindset. But how you start, focusing on what is most important for all, it can really trigger a positive chain reaction on how the rest are going to be affected, because they're all, interconnected. But starting from the right one is going to reduce a lot of the pain, the effort, and the time that you see improvements. Of course, in my case, I didn't know in the beginning to start from the, from the right one. For me, I played with different things and I wasted a lot of time. But I don't want now people to waste, not to waste, because it wasn't a waste. I've learned a lot of things that I'm sharing now with you, but to spend 20, 10 years, 4 years, I don't know, whatever, to try and figure it out. Sometimes they won't even manage to figure it out. They will just completely get lost in the, loads and lots of information that is out there and get completely overwhelmed. And yeah, I mean, that's what I don't want you to, I don't want you to be in that place, and I don't want my clients to be in that place. And I was trying for a long time, for over a year now, to just find a formula or a protocol that can actually be a little bit more helpful in a simpler way without getting people confused and lost. But be aware of new absolutes, because yeah, I mean, people mention here, yeah, what did that for me was inflammation. Yes, Deborah, there is a way to find about inflammation. Yeah. Um, yeah, so it's inflammation. I'm just looking now at the chat, so I'll get back to the at the end to answering your questions. So beware of the new absolute. So it's not all about mindset. It's not all about stress. It's not all about inflammation. It's not all about supplements. So yes, it's not all about calcium as well. But putting the focus and the weight of our attention where it needs to be done in the beginning is very, very important. So context matters, personalization matters, and nuance matters for everyone. And I keep saying that. But unfortunately, and I was having this discussion with another colleague of mine who is a specialist in nutrigenomics like myself, in DNA guided approach, it's difficult to get there and bring it in a kind of a group setting, but it's not impossible. So here, yeah, the constant searching for answers, Marilyn. I know, and I understand. You know, for you that you're sharing in the chat, I'm going to get have some more people to admit here. I'm going to get back to at the end of the presentation. But bone loss risk factors, these are some. There was a presentation that I had for practitioners, so for professionals a few months ago, in collaboration with the Institute for Optimum Nutrition in Richmond in London. And this is just an extract of some of the bone loss risk factors that have nothing to do with menopause, by the way. I mean, some of them, you know, beginning vitamin D, abnormal calcium levels, high PTH, you probably know them. But thyroid issues, Hashimoto's, low FT3, low FT4. In my case, it was low T3 because I had low iodine, for example. That was a big driver of my bone loss. Absorption issues, celiac, Anne mentioned yesterday here, celiac, her number one driver probably of bone loss happened in her own life, and she didn't discover until very, very recently. Someone else to admit here. Crohn's, chronic IBS, not even something, well, I mean, chronic IBS is severe in my, in my opinion, because we dismiss it. Oh, it's a little bit of bloating. Actually, well, it's a little bit more than bloating. Long-term antihistamine drugs that are used for allergies, and actually allergies themselves can actually lead to bone loss because we're talking about inflammation. That's another inflammatory cause that can lead to bone loss, and it's kind of hidden until we get into to menopause. Cancer history and cancer treatments, obvious, but some people don't know it until unfortunately they get there and they have the cancer. Autoimmune conditions, again, inflammation and immunity, primary factor, primary driver. Immobility or excess exercise is something that I see in athletes or people that over-exercise, is osteopenia and osteoporosis. More than 50% of the younger people that come to see me with osteoporosis or osteopenia are because they're over-exercise. They're other athletes or amateur athletes or someone who over-exercise as part of, some sort of behavioral issue, OCD. Sometimes it could be a form of eating disorder as well, by the way. And of course, history of anxiety and depression. So these are just some of the things. And you go, oh my God, all these things. So you have to look at the whole picture here. What is the risk factor for you that is the number one that you need to start from? I mean, in my case, it was stress, definitely. And the second one, I would say, was iodine and my thyroid function. It wasn't only my iodine deficiency, which, I confirmed later on with testing, but I also, as I confirmed with testing again, genetically, I have some issues around how my thyroid works. But the problem is how you can get there without doing all this testing and without spending all these years and spending all this money. Where do I start? And that is, the answer is tomorrow. And tomorrow is going to be a little bit more practical. I get to your questions now for people that shared in the chat. So tomorrow we'll look at the practical steps, nutrition and movement, why generic advice fails, and how to identify your priorities. So tomorrow is going to be a lot more practical. Tomorrow is going to be Thursday, so I'm hoping a lot more people are going to join live as well. Yeah, and let's go back to the chat. I mean, I'm going to go through your questions, and yeah, I mean, what is the one thing that you see differently after today and yesterday? If you were here yesterday, yeah, Marilyn. Some people trying to come in. Patty, just welcome. We almost finished in the conversation and we are in the questions and answers now, but you can receive the recording later. So Marilyn, the constant searching for answers and not being active. So that's what you identified today. Yeah, I mean, the constant searching for answers itself, it can be a stressful thing. It was for me. And if you were not here yesterday, I mentioned at some point, I had multiple Excel spreadsheets that I was keeping records of absolutely everything, what I was eating, what I was taking in terms of supplements, the amount of exercise I was doing, how I was feeling. And I was just trying to figure out, what the problem was for me. So only the constant searching for answers can be extremely stressful and extremely confusing. It's an extra stress that is not helping with your bone loss. You need things to be simpler for you. Is there a way to find out if you have inflammation, blood tests and everything? Yes, I'm sharing that tomorrow. I have a framework for that. There are some blood tests, like I mentioned yesterday, some normal blood tests that you can do is CRP and HS-CRP. But unfortunately, to get to the levels that these are elevated, you need to be very inflamed. But there are other things that you can do about inflammation, that you can assess inflammation before that, and without paying for expensive tests. Inflammatory diets. Do you find eating foods that help reduce inflammation? Yes. And that is also part of what I'm going to discuss tomorrow. Yes, definitely. An anti-inflammatory protocol is good for absolutely everyone. And in general, because we mentioned gluten yesterday, I think I'll stop sharing my screen here to be able to see you, some of you. I mean, you can turn your video on if you want. I think it mentioned yesterday, having a low gluten diet, for example. Well, if you are celiac, you need to exclude it completely. But even if you're not celiac, having a kind of lower gluten diet is definitely on the inflammatory side. But again, if you're not celiac or you're not gluten intolerant, then again, being very religiously restricting gluten and refusing to eat it, again, it might be a little bit too much, and it can it can be very stressful for you. I tried myself being 100% gluten. I don't need to, but I try to do that, and it's very difficult, especially if you don't need to and you're not motivated to. And at some point, it was when I was going out, I had to be very, very picky about what to eat and what restaurants to do. And if you don't need to do it, it can be very stressful. So in general, have a lower gluten diet is anti-inflammatory, but if you don't need it, then it might be an extra stress that you don't want. So again, you have to think about personalization. Anti-inflammatory diet, including avoid wheat. Yes, Julia. Yeah, I think we discussed this in the past. Yeah, for you, that was a big one. Yeah. Wheat, by the way, I'll share another little secret here with you now. Wheat, except gluten, has a lot of other proteins that are very allergenic, wheat proteins. I think it has about 30. I don't remember from the top of my head now, so I might be wrong. And sometimes this can be, for some people, even worse than gluten. And that's why I'm saying personalization is key. In my case, for example, in general, I'm okay with gluten, especially barley, gluten that comes from barley. But rye, it's not the gluten in the rye that upsets me, and actually have digestive symptoms with rye as well. It's actually another protein in the rye, which is also very allergenic. So for me, and I'm saying that because for years, I mean like 20 years or something, I was eating rye as a better choice, instead of having wheat. And actually, rye was for me. So again, it's about personalization and creating a roadmap that is good for you. But if you do it with guidance and you don't get lost, it's easier. It's just, yeah, you just have to get to these states that it's simpler as well. Presently, alendronate to delay bone loss. I'm struggling with the side effects, says Marilyn. Wanted to build bone, not just delay. Yes, Marilyn, as part of my framework, even though my framework is completely natural, I also give some information about the different medications, which of course I'm not against in any way, but I'm not a medical doctor, and in some cases, medications, especially when bone loss is accelerated, might be helpful. What happens with alendronate, which it's a biphosphonate, it's like almost stops bone loss. And as I mentioned during the presentation, stopping completely bone loss is not healthy because we need to lose the older bone. But of course, if at the same time you focus on the 4 pillars that we mentioned here today, if you join from the beginning, and we mentioned yesterday, if you're not, you can see in the recording: nutrition, movement, inflammation, and emotional health. You also need this so you can build bone. So the side effects that you usually have with these medications are usually digestive. Some doctors give Reclast or Aclasta, which is a biphosphonate, but you take it as an infusion, and that might bypass the other side effects, the digestive side effects. But again, as a drug, it's the same function, so it doesn't really change anything. And actually it can have some additional side effects that are more like heart related. So, it is what it is, and you can't take them for too long. One of the problems that I have usually with my older clients is that they've been on biphosphonates for a very long time, and then they need, not for a long time, because you can't be for a very long time. 3 to 5 years is the maximum now, we know that. And at the end of the 3 or 5 years, they stop them, and they have to do something about it to actually maintain any sort of gains. And doing that in a way that is efficient, it's very hard. And even harder with Prolia. Prolia is not a biphosphonate, but it also stops bone loss or delays bone loss. With Prolia is even worse, because when you stop it, the bone loss accelerates. So if you haven't built the 4 pillars, the foundations, if you are on these medications, if you stop them, because you will stop them, you can't take them forever because of the side effects. That's what the doctor's protocol is, not mine. If you haven't built on that, then again, you're lost. So after the 3, 4, 5 years, you have nowhere to go. And maybe you can take some anabolic medications like Forteo, for example. There are some other medications out there. As part of my framework, I also educate people on different medications. I don't want to spend too much time on medications here because that's not what we're doing today. But these also very, very bad side effects. You can only take them for about a year or 2 years. So again, what happens after that? Because thinking menopause for most women starts around 50, let's say, or let's 52, 53 or whatever. After 5 years, you're 55, you're young, especially now. I mean, I'm 53. Come on. I mean, you're young. 60, you're young. I mean, the majority of my friends and the people I work with are 60, 65 plus. They're still active. They go out for like skiing and hiking, and they're doing whatever they like, and holidays with the children, the grandchildren. You're still active. You're not dead. I mean, what is going to happen after 10 years? You're going to be 65. You know what I mean? And see all what happens now with women everywhere. And I'm not an influencer, but there's a few people that are also influencers, and I respect, and young women that I consider them young, in the 50s and the 60s, and they're still active, and they go out there and they're talking about the second life that a woman has after menopause, after they go into the 50s and 60s. I mean, unfortunately, the drugs are not going to help you with that. Low testosterone is an area for me to focus on. Yes, Julie, I think that's something that we discussed in person. Low testosterone in women, and I know you think testosterone is about, men, but actually one, as part of the framework, the test framework that I recommend is also testosterone testing, because you need to know what happens with your testosterone after menopause. It actually can help you with any sort of depressive issues, can help with motivation. It can also help your bones as well, and your libido, by the way. Because estrogen, there's not much estrogen then. What is the relationship between bone marrow and osteoporosis? A direct relationship, that's a question from Anne. There's not a direct relationship between the bone marrow and osteoporosis. However, if you have, what I'm trying to say, if you have osteoporosis, sorry about the noise, there's some noise around today. If you have osteoporosis, it's not going to cause any bone marrow lesions by itself, okay? If you have a fracture because of osteoporosis and the fracture is not healed, that might become an edema and a bone marrow edema and can cause some issues there. If you have a bone marrow condition for a very long time, that can happen because of bone cancer or some form of genetic issue or something else, some other condition, then over a long period of time can impact your bone density as well. So again, it's not really a very clear, a direct relationship, but in general, for the majority of women that have osteoporosis, to have an effect on the bone marrow, no, unless they have a severe fracture that is not healed. I think so, yeah. Yeah, people, you are muted, but you can unmute yourself if you want to speak instead of putting things in the chat, by the way. It's up to you. Brave Chicken Whisperer, I like your name. So it seems like what is holding me back is stress and emotional management. Any suggestions? I'm talking about this tomorrow, if you don't mind. I have lymphedema in my legs and osteopenia in my left femur. But what is the cause of the, well, in your case, I would say I would focus more on inflammation because lymphedema is usually a symptom of your heart and your lymph system not working properly. So it's a circulatory issue. Do you move enough? And movement again. So I would focus in your case, I think probably mostly inflammation and movement. Venous insufficiency. So venous insufficiency, but for what reason? Again, inflammation, something else happening. That's what you need to focus on. And by the way, talking about the bones being a living tissue, circulatory problems, because I think I'm going to show back the picture. Let's see, the picture that I have here on my, let's see. Let's see, maybe I have it here again. Yeah. So you see here the bone. Oh, can I slide? Oh, here it is. Yeah. You see the structure here. So for nutrients to go into the bone, to go in here, they actually go through a very complex, network of blood vessels that doesn't show here. It's a very simplified picture actually. But to go into the bone, for nutrients to go into the bone, whatever you're giving it, like protein, amino acids, in this case, calcium, other minerals, it goes through a very comprehensive and very complex network of blood vessels, which it doesn't show here, but kind of like imagine it. So if this doesn't if there is some sort of venous insufficiency or artery insufficiency or circulatory problem, then yeah, it's going to be an issue for your bones. The bones are not going to be fed as good. Anton, yeah, I think you joined late. The reason why so many women have osteoporosis, especially, it's because, not because of menopause, but because of the hormonal fluctuations that happen throughout our whole life. And we ignore them. And actually in the States, it's starting getting a lot more recognition now. And it does seem in the States they're a bit more forward thinking and that what we are in Europe. And they're talking about the syndrome, osteoporosis, post-pregnancy syndrome, which actually happens pretty much in all women. It's just that most women can actually bounce back from that if they, if they eat well, if they exercise, if they still have their periods, and they're regular and they don't have any hormonal fluctuations, then they can bounce back. But some women, they don't, and especially as women now get pregnant at an older age, or sometimes through IVF, which completely steals everything from your system and your bone. And if it's not necessary to do, I wouldn't recommend it to any woman, but that's a personal decision. And if you do it, you have to be thinking of your bones as well, not only your hormones. Because of women becoming pregnant now at a much later in life, they're actually a little bit more prone to bone loss, especially in the vertebra. That happens because this is a part of the body that doesn't move as much as the rest of it. I mean, it just moves just slightly, but there's not so much movement. And there's not supposed to be a lot of movement there, and especially in kind of the lower back. I mean, the neck, you move, the upper body, you move, but the kind of like middle back element, which is the lumbar spine, which you get more of osteoporosis, does not move much. Also, this is the part of the spine that has the bigger vertebra. So you need a lot more nutrients, and also another thing that happens is that the vertebra, the spine on the DEXA scan is not measured, is not assessed correctly so well, because the vertebra, if you think about the spine, it has natural curves, and the DEXA scan, you just do it lying on your back. So by default, you can't get a good picture of your spine. And I give an example of myself. I also have scoliosis and a lot of problems with my vertebra, not because of my osteoporosis, but because of accidents that I had as a child, actually. So because of that, it's even worse. It's even worse. Let's see. Oh, I didn't record. Oh my God, I forgot to record. Excellent. So guys, if you join tomorrow, just please remind me to record. Hopefully I managed to get some recording on my phone. We'll see how it goes. Let's see. Is REMS more accurate for the spine? Yeah, usually REMS, which is another technology, is more accurate on the spine. Yes, yes it is. Right, so you can, I think I have to close now if I don't have any more questions for you. So tomorrow we're talking about the practical steps. I messed up today. I don't know how I do that. I forget the recordings. I think I have to do Zoom to do the recording, automatically every time. I think I still managed to record some stuff on my phone and settle with the rest. And so I'll see you tomorrow, same time. Tomorrow we're talking about the practical steps. Hopefully it's Thursday, so we'll get some more people live. Thank you very much for being here today. Remind me for the recording tomorrow. And I will see you tomorrow. Thanks, Deborah. Thanks, Anton. Thank you, everyone. Bye. For everyone